Hi, I'm Tom Lynch. Two things. Peter, day one of Epic. How are we doing?
So far, so good. I mean, people have worked really hard to get ready for April 2nd. People continue to work hard to work out some of the kinks in the system, but I think we're in as good a shape as we possibly could be at this point. And that's not to say that things are working perfectly from our clinicians' standpoint, but hopefully over time the system will just continue to get better and better.
A great example of everybody at the MGH working together to accomplish this.
Not only the MGH, but partners, Epic, Accenture. It's really been a team effort to get us to this point.
And the second thing is, you've been spending a lot of your effort and focus on capacity. Can you tell us a little about the Capacity Task Force and what it's working on?
Sure. I mean, one of the good news about this hospital is how there's such strong demand for our services as a result of our physicians, the hospital as a whole, and so we need to be as creative as possible about how we use the capacity that's available to us. And I think the biggest constraint at the moment are inpatient beds. So we need to think creatively about how can we care for patients that now occupy inpatient beds and other facilities at home, and as creatively as we possibly can. We also just need to make sure that our operations are as efficient as possible.
And if you could say one thing to docs that they can do to help with capacity, what is it?
I guess for patients that are in the hospital, think about ways, think every day, more than once every day, does a patient really need to be in the hospital? Is there some other level of care that would be appropriate for them? And for patients, and before thinking about sending a patient to the emergency room or to the hospital, is that really a necessary step? Could they be cared for by a home observation unit? Could they be cared for at a rehab hospital or a skilled nursing facility? We need to use all levels of care as effectively as we possibly can.
Peter, thank you very much, and let's hope that the next several days go as smoothly as the first day has in our Epic implementation. I'm Tom Lynch, and that's Two Things.